This video is intended for those diagnosed with spondylosis who are over the age of 55 or those who have increased risk for spondylosis.
Cervical spondylosis. Our goal is that by the end of this video, you will be educated on the following objectives. What is spondylosis? What causes spondylosis and who is at increased risk? Prevention strategies on how to reduce your risk. And finally, what research shows as the most effective treatments. Everyone develops a degree of degeneration in the vertebrae as a normal part of aging. As the discs become thinner, the adjacent vertebrae develop small, rough areas of bone on their edges, which can irritate the nearby muscles, ligaments, and nerves. This may cause symptoms such as neck and arm pain, weakness, abnormal sensations, and headaches. When the changes affect the nerve root and cause pain, weakness, and abnormal sensations, it is known as a radiculopathy. I'm sure you're wondering what the signs and symptoms of cervical spondylosis are. Let's meet 67-year-old Gertrude, who has your typical symptoms of cervical spondylosis.
Oh, come on in, Gertrude. Have a seat.
Thank you.
I see in your chart here that you have been having some neck problems.
Yeah, I have a lot of pain back here in my neck. It's killing me. It's giving me a lot of bad headaches. Can't even think straight.
Are these your only symptoms?
Well, no, I also have some pain back here in my shoulder and sometimes in my arm. And actually, I want you to take a look at my hand because I can't seem to hold on to things very well. I keep dropping things a lot.
So would you say that the sensations you're experiencing in your arm, it's not normal? You haven't had these before?
No, probably for about a month. Same time as the neck pain really started hurting.
Would you describe it as weakness or pain?
All of the above.
Okay. Have you noticed you've been having any trouble? Have you noticed any motions you've been having pain?
Well,
looking
you
side
know, when
to
I
side?
try to look out the window, like to kind of this way, it seems to hurt quite a bit.
Okay.
I can't really look as far as I'd like.
Okay. And so are these your only symptoms, you'd say?
Yeah, that I can think of right now.
Okay.
There are many ways to determine if your symptoms are caused by spondylosis. Your physician can diagnose spondylosis through multiple types of imaging. Your physical therapist can also determine the best treatment for you based on your inability to turn your head more than 60 degrees to one side, as well as performing special tests such as the upper limb tension test, a cervical distraction test, or the Sperling's test. If it is determined that you have spondylosis, there are many different treatment options available. Although surgery may be necessary at advanced stages, there are many other options available to treat your pain with physical therapy. Some of these physical therapy interventions include cervical traction, postural education, exercise, and manual therapy. Studies have indicated that a combination of these treatments will result in improved outcomes. Now let's take a look at some of the interventions that were given to Gertrude during her appointment to help her symptoms.
So, Gertrude, one of the most basic ways to relieve your pain and symptoms is to maintain correct posture.
Oh, that sounds pretty easy.
When you have correct posture, it actually decreases the amount of stresses applied to your spine, which can lead to the abnormal wear and tear that is associated with spondylosis.
Okay.
So this is a picture of a neutral spine, and as you can see, there's natural curves. So when I show you me sitting with correct posture, you'll notice that the lower curve in my lower back actually caves inward a little bit. And then moving up my back into my mid-upper back, you'll notice that it curves outward slightly. And then behind my neck, it curves inward.
Oh, I see that.
All right, Gertrude, let's take a look at your spine now. Based on what I just taught you, do you think you have correct posture right now?
Well, looking at this so-called neutral spine, I think this area, I need a little bit more of a curve. So I'm thinking I have to be more like this, maybe.
Yes, that looks better. And actually, to help you maintain that position, if you feel like you're having difficulty holding it, you can put a little towel roll behind. I'll scoot back.
Oh, that's comfortable.
Yeah, it'll help you with comfort too.
Oh.
And that'll help you hold that position. Now, what about your mid to upper back?
Well, I'm thinking I got that curve, but maybe just a slight too much. How about like this?
That looks better. And actually, you nailed it right on the head. By pulling your shoulders back, that'll help you decrease some of that excess hunch.
Oh, and I can feel that seemed to make that my top of my neck curve inward a little bit more, kind of like this picture.
Yes. So by maintaining a proper lower back curve and your mid to upper back, that's going to help straighten you out behind your neck.
Great.
So next we're going to focus on stretching.
Sounds good to me.
Stretching is important because it's going to maintain and promote motion in your neck.
You need some motion.
So the first stretch is we're going to put our neck all the way down to our chin. And if you're not experiencing any pain, I want you to add a little overpressure.
I think I might need to take my bonnet off for this. It's kind of getting in the way.
Okay. And I'm going to show you how much pressure you should be adding. Just about like this much.
That feels pretty good.
Okay, so try it to yourself. And I want you to hold that position without pain for 10 seconds. And then come up. And then we're going to go to your left. And add a little pressure. For 10 seconds. Any pain?
Nope.
Alright, let's try it to the right. Still okay?
Yep, feels pretty good.
And I want you to look all the way to your left as far as you can. And then add a little pressure. And then all the way to the left.
Oh, this is the side I have some trouble with.
So go as far as you can.
Oh, it feels pretty good though.
Any pain?
Nope.
10 seconds. Come back. Okay, so I want you doing those 5 times. And each time holding in for 10 seconds.
Okay.
And then do it 5 times a day.
That seems like a lot.
It does, but it's really not.
Well, that's good.
Okay. And then the last one is called a retraction. And so I almost want you to pull your chin like you're giving yourself a double chin.
Oh, that's not a good side. Oh, man.
Don't worry, it's not like we're being filmed.
I don't want even you to see that.
It's okay. So
I'll do this at home with no one watching.
yeah. So just pull back and hold it for 10 seconds. And then come back. And we're going to do it again. Hold it for 10 seconds.
I got that double chin.
Yep, you're doing good. So you're going to, how many times are you going to do that?
5,
And how many times are you going to hold it for?
10 seconds.
And then how many times a day?
5.
Can you show me all the motions again?
So we're going to go forward, down, 10 seconds, side, to the other side, ooh, trap. This way, this way, and this bad one. I don't like this one.
And how many times?
5, 5, 10 seconds.
Good. Next we'll focus on strengthening.
Sounds good to me.
So the first exercise I want to show you is called a scapular retraction. And this is going to help strengthen your back muscles to help you keep proper posture, keep your shoulders back.
Posture's important.
So what you're going to do is you're going to pull your shoulders back and you're going to squeeze your shoulder blades almost like you're holding a pencil between them.
How are you doing that?
Alright, so what I want you to do
Am I doing it right?
is I want you to pull your shoulders back and squeeze my finger between your shoulder blades. Good. Now hold that for 10 seconds. Keep holding.
It's a lot of work.
And now relax. Ooh, you were weak back there.
Ooh.
See, good thing we're strengthening these back muscles. All right, I want you to do it again. Pull your shoulders back. Squeeze.
Yeah.
Keep squeezing.
Trying to keep my head up.
Good. And you're going to hold this for 10 seconds. Now relax. One more time.
Oh man, you're killing me.
Good. Now, I want you doing those 10 times a day, or 10 repetitions, and you're going to hold each one 10 seconds.
Been working like crazy, man.
Yeah, so you can do five of them and then take a break and then do 5 more. But make sure
I
you're
think
holding,
that's doable.
make sure you're doing them each holding for 10 seconds. Don't
10
just
seconds.
pull them back and then relax. I want you actually holding it.
10 seconds.
Now to strengthen your neck muscles, we are going to have you lay on your back.
On this?
Mm-hmm.
Finally, I get to lay down.
Scoot down a little bit. So we're going to do the
Oh,
dreaded
no.
double chin.
As long as no one's watching.
Now I want you to pull your chin down.
Oh, man.
Pull your chin down here. There you go. And I want you to slightly lift your head up about an inch off the mat.
That?
Yep, now hold it.
Oh, that's harder than you would think.
Mm-hmm. So just keep your chin, pull your chin in, give yourself a double
I
chin.
don't like that.
It's okay. I'm not looking.
It better not be.
And I want you to hold this as long as you can. Keep your head down a little. Keep your head
I'm
down.
losing steam.
Whenever you start feeling pain, just relax your head.
Need a break.
Okay. So I want you to hold that as long as you can. I want you doing that at least twice a day. So
I
whenever
think
you
I can handle that.
So try one more time. Show me.
Like this?
No, it's way too high
No?
off the mat. So tuck your chin
good.
in. Tuck your chin. And now slightly lift your head.
Oh, like that.
Right there. No higher than that. Nope, it's too high.
Ooh, sheesh.
Tuck your chin.
What do I think? Okay. Like that?
Mm-hmm. Keep holding it. Keep holding.
Oh, that's enough.
Okay. So can you just explain to me and repeat those two exercises?
Alright, so I'm gonna squeeze a pencil behind my shoulders.
You don't actually squeeze a pencil, but
Oh, okay. Pretend like I'm squeezing the pencil. I was
Mhm.
gonna say, that's gonna be rough. Alright, pretend like I'm squeezing the pencil.
mm-hmm.
Okay. 10 times. 5 times. 10 times.
10 times.
Count these numbers.
So how many times?
10.
And how long are you gonna hold it for?
10 seconds.
Mm-hmm.
And then I'm gonna do the dreaded double chin, the privacy of my own home,
Mm-hmm.
as long as I can, twice a day.
Yes.
Okay.
So how many times for the shoulder one?
10.
And how long are you gonna hold it for?
10. 10's a magic number.
There you
Okay.
go.
Alright, I think I'm good to go.
Okay, so we're just gonna stick with those two exercises right now
And all my stretches.
and all the stretches, and I think that should help with some of the pain.
Okay, that sounds good to me. I'll make sure I have some better posture next time I come in too.
Okay.
In summary, cervical spondylosis is a disorder in which there is abnormal wear on the cartilage and bones of the neck. Signs and symptoms include headaches, pain and stiffness in the neck, and can also include weakness and abnormal sensations in the arms if the condition has progressed to a radiculopathy. Cervical spondylosis can be diagnosed by your physician using X-rays and MRIs. Your physical therapist may also use tests such as range of motion measurements, upper limb tension tests, distraction tests, and the Sperling's test to guide treatment. The treatment interventions include postural education, stretching, and neck muscle strengthening exercises. Postural education is important to reduce the amount of stress placed on the spine and prevent further injury. Research has shown that when stretching and strengthening is incorporated into an exercise program, there is a significantly larger decrease in pain and disability. When incorporated, these forms of treatment can also have a positive effect on one's psychological state.